Welcome. We're here to talk about the Health Heroes program.
Hello, I'm Michele Rutherford, and I'm here representing the Alameda County Emergency Childcare Response Team, which has a partnership with Samuel Merritt University. I'm an employee of First Five, and we're part of the partnership of the Emergency Response Team, and we developed this program really in response to providers' anxiousness and needs around how to operate during COVID and all the changing regulations and guidance. So we're here with Sonni Collins, who is a health hero, which is our health consultation partnership. And she is a student at Samuel Merritt, and she's going to share with us some of her experiences working with her childcare site that she did rotations with. So Sonni, tell us a little bit about yourself and the site that you were assigned to.
Okay, so my name is Sonni Collins, and I am a second year ELM student with Samuel Merritt University, which means I'm about a third way into becoming a nurse practitioner at this point. In my background, I own my own childcare, a large family daycare for about 7-8 years. So this was the perfect opportunity for me to come in from the other side and be the relief that I would have wanted to see if I were still a childcare provider. The site that I was assigned to was St. Mary's Children's Center, which is a preschool that serves 3 to 5-year-olds in West Oakland. And they normally have about 24 children. They were preparing themselves to open up for about 12.
Great. So typically the nursing students from Samuel Merritt are paired with a site with 2 students, and they go out a couple times a week for a series of weeks. Each cohort's a little bit different. Tell us a little bit about what you did. I know that the nurses come in their scrubs and bring your own PPE, and then work with the site leadership to make plans for how to support the site. So tell us about your experience.
Yes, so myself and my partner, Hane, we came in and visited the site first and had a meeting to find out what the site needed and, what type of questions they had, what their struggles were, and also just to observe and see if we could identify any other areas that they might want to consider in keeping their facilities safe. So we came in and did like a assessment, talked to the director and her staff person, and we talked right there then and there about mask wearing, and we learned their hand washing song, and we saw ways we can improve things. So once we gathered all of our information, we used the Alameda County frequently asked questions document in order to guide us, as well as our training in school. And we devised a PowerPoint that the school could use as long as they want, or until, the CDC updates their rules again, that they could use and train their staff as they go along, because they were also going to need to hire new staff.
Great. And so what else did you do to support the site?
So we taught the staff that was there, we taught them about proper hand washing, things they might not have thought about. We taught them about, just even teaching a child the proper way of wearing a mask. We talked about when you should use a new smock, or using your smock properly, button it all the way up. We also gave some ideas and pointers towards how they could set their facility up. They were just getting started again, and they had just remodeled. So we gave them some ideas on how they can separate the little areas, have little cohorts of children, their cleaning of their toys and supplies, and having a dirty space, a clean space. Just looking at, where their hand sanitizers were placed, things of that nature. We talked about their outside area. We could do hula hoop separations. The children could still play, but be apart. And we talked about how the parents could be safe, signing in and signing out their children, keeping their own separate, envelopes, and signing utensils, so that each family is, safe when they're signing in and signing out, and how they would greet the children in the front, how they would stagger their pickups and drop-offs. We kind of went through everything. We gave them also 2 PowerPoints. One was for their parent meeting, so they can start explaining to the parents of the children, you know, even if someone's sick in your house, and different things that they would want to talk to the staff about, or, things they could do to keep themselves safe and keep their children safe. And they have a PowerPoint they could use for their parent meetings or new parents coming in. And we focused it both for Spanish and for English, because they have a lot of Spanish speakers as well.
Great. I'm sure that was really helpful for the site. So in terms of, if there's a family child care provider out there or a center out there that has been on the fence about whether they should apply to Health Heroes and be a site, because we have a number of cohorts coming up over the next year, what would you say to them to encourage them to apply?
Well, first and foremost, I'm going to say this is a program I would have wanted to help me in my own child care. Had I been open during these trying times, I would totally have wanted someone to come in and just look around and help me out. The great part about it is that we are coming as students with fresh eyes, with fresh information. We have the most updated information because this is what we're being taught in real time. And speaking about being taught in real time, we have the best faculty in the world. Our faculty are also healthcare providers themselves. And so they come from, a lot of knowledge. So if there is a question that comes up and we don't have the answers, they're right there, one phone call away. And if we wanted them to come in, they could too. But we, as students, we are in our graduate level of education. So we're bringing a lot of information and knowledge, but like I said, fresh new ideas to the scene. And we can, just be there to guide you through this, see what else you might need, and just be a helping hand and lay eyes on things and just help you keep your baby safe.
Thank you so much, Sonni, for sharing your experience with us. And I hope folks are encouraged about what a great opportunity this is for you. And the link for the application is in the video. And we look forward to having you all participate. And Sonni, best to you the rest of your nursing training.
Thank you so much. And thank you for giving me an opportunity to work with you. It was great.
It's great working with you too. Bye.